Wales also has a well-developed network with close to 500 different NHS sites that could be connected up through video conferencing. I travelled to South Wales to find out how the link between two of those centres, Morriston Hospital in Swansea and Bronglais in Aberystwyth, is being used to help patients with neurological problems by connecting them with consultant neurologist Nigel Hines. Delyth Lewis is Telemedicine Service Manager of the South West Wales Cancer Network, and while the technology may be cutting edge, the setting in which it's used is not.
We're in the Wheelchair Rehabilitation Centre in Morriston Hospital at the moment, and this is where Dr Hines does his clinics from. We're actually standing outside the waiting room. The video conferencing equipment today is in the waiting room. It can be used either in the waiting room or sometimes it's used in the sewing room, which is actually a bit weird because he's surrounded by sewing machines, but it's where the availability of the equipment is.
Right, well, let's
like to go in here.
Let's have a look. Right, so here's the equipment. Looks like it's on a trolley, so it can be moved from room to room.
That's right, it's a portable equipment. It's on a stand, and we've got two monitors with a camera. And as long as it's plugged into a network point and into a power source, then it can be moved around and used in any room.
And the network point is into the internet, is it?
It's into the hospital network, yes, right. Internet, yes. And it all sits on the Welsh Health Video Network, so we've got secure and high encrypted secure broadband.
So two televisions, flat screen televisions. One looks like it's the camera's shining at the chair. I can see myself if I sit in the chair. And the other one is what?
That's who you'll see on the remote site. So the idea, you'll see yourself on one screen and the remote site on the other side.
How do the patients take to it? I mean, it's a bit strange seeing myself on television.
Yes, and it's opposite as well. If you lift your hand up,
oh yeah, mirror image.
That's right. So it is a bit difficult. The setup we've got in Bronglais is a smaller unit, so we've got two little screens side by side. And when we started the project off, we did a patient evaluation for the first 50 patients that filled in questionnaires. And we had 100% patient satisfaction. We did have a few comments that patients didn't like seeing themselves, so with the one in Bronglais you can actually switch that monitor off so they'd only see Dr Hines, and some patients prefer that. But we explained to them before they went in what they were going to see and what they would experience, and they all responded very well to it.
I'm just looking at my watch there. It's quite high resolution as well.
Yes, it is. It's high resolution, and it's on a good speed. It's on a high speed, so we can share digital images on it, pathology images, any PowerPoints, anything you'd want to share. Really, it's possible.
Do you record any of this?
It's not recorded. It's all just live. You can record it, but we don't go down that avenue. Everything is just a live.
Let's talk about the neurology clinic. That's presumably a neurologist, a few and far between in any part of the UK.
That's right.
I suspect Wales is no exception. So the idea with that is once again that neurologist doesn't have to travel to the patients and vice versa.
Yes, well, it started off for Bronglais when we had, historically, the consultant used to travel to Aberystwyth every 3 months for a clinic. And then with a change in the consultant contract plan, they wanted to include the travel time in his clinic time. Now, anybody who's travelled from Swansea to Aberystwyth would realise what the roads and the journey is like. It's at least 2 hours journey, not an easy journey either. So they came to the telemedicine service, and the Hywel Dda Health Board, as it is now, asked us to look at the feasibility of using video conferencing for the patient consultation. So we started off by doing an opinion poll of the patients on the current waiting list, sending them a questionnaire, asking them what did they think, and we had a good response to that. So as a result, we put a new service model together. So the Dr Hines here selects the patient off the waiting list. They're sent an appointment to attend their local hospital. They're also given the option to attend in-person consultation in Carmarthen if they wanted to, if they didn't want to use the video conferencing. Their day of the appointment, then they attend the appointment in Aberystwyth with their outpatient nurse and Dr Jones, the clinician, the consultant physician there. And then for the trial, after they'd finished their consultation, we'd ask them to complete an evaluation. As a result of this, after the first 50 patients have been evaluated, the impact was that we reduced the frequency of the clinic to every 6 weeks instead of every 3 months. So patients can come to clinics every 6 weeks now. There's no waiting list. We've reduced the waiting list, and of course the neurologist doesn't have to travel to Aberystwyth.
A lot of the clues to making the diagnosis and managing a patient in neurology will be on the story, and I can see that's fine. I can sit and ask questions of the patient. But it also involves examining, testing for power and tone and feeling and watching patients walk and that sort of thing.
That's right.
How does that happen?
That works. That's why we have Dr. Jones in Bronglais. Two reasons. We don't have electronic case notes, so the case notes are held in Aberystwyth, so Dr. Jones looks through the case notes. You can also request any radiology tests or blood tests, but he also helps with the examination. Right. So if there's a walking test, he can do it. And the beauty of this is that Dr. Hines can control the Aberystwyth camera from here.
To look at the right bit?
Yeah, so he can move it. So the nurse doesn't have to say, right, okay, stand up, move. Dr. Hines can do it himself. So Dr. Jones will help the patient and do whatever test is required, and Dr. Hines can follow it himself, what he wants to see. The same if an examination on the bed is required, he can actually view it. So Dr. Jones really is his pair of hands, if you like.
We caught up with consultant physician Dr. Phil Jones in the clinic at Bronglais just before the start of Dr. Nigel Hines' next neurology clinic.
Well, we have a telemedicine neurology clinic this morning whereby patients living in the local area will attend the clinic here, and they will discuss their symptoms with Dr. Hines in Swansea. If there's a need to examine the patient, then I will examine the patient on Dr. Hines' behalf here. He will be able to obviously see the patient, hear their story, witness the examination and direct the examination as required, and then formulate a diagnosis and management plan for the patient without the patient having to travel to Swansea and back, or equally for Dr. Hines to travel up to here and back.
My name is Gemma Geimer. I was diagnosed with epilepsy about 2 years ago, and so today's a check-up to see how I'm doing. Well, I have an appointment with Dr. Hines, who's a neurologist in Morriston Hospital in Swansea, and I'm in the room in Aberystwyth with Dr. Jones, and we both speak to Dr. Hines via teleconference.
All the patients for this clinic are selected by Dr. Hines, and I think it's fair to say, but you can ask him yourself in a second, that the patients are those that he feels can be dealt with over a video link, that he doesn't actually have to see them in person. So a large number of patients will be follow-up patients, perhaps with chronic problems like epilepsy, or myasthenia gravis, for example, rather than perhaps more complicated new patients who may still have to travel to Carmarthen, for example, to be seen. But Dr. Hines will be able to tell exactly how he triages patients.
Neurologist Nigel Hines was 75 miles away in Swansea, but thanks to the video conferencing system, was able to step in and explain in person what sort of patients are most likely to benefit from the telehealth clinics.
Well, most of the patients I've already seen before and examined will be suitable to be seen in this sort of telemedicine environment, particularly if they in advance have agreed and they're happy with it. Particular types of patients might be patients with epilepsy, for example, where I'm generally not examining the patient, I'm generally sort of asking them how many seizures they've had, side effects, what medication they might be on. I don't have to physically be there in front of them to manage their epilepsy, for example. So epilepsy would be a typical example of a patient that could be quite easily seen in this sort of setting.
I think there's always the option that if the patient needs to be examined, then that can be done, and somebody needs to be here to do that. Of more importance to me, I think, is that if we're seeing, for example, an epileptic patient, if that patient has a fit or a series of fits, they'll come to this hospital. And if nobody knows them in this hospital, then their care is not as good as it could be. Whereas at least through this system, I have some knowledge of the patients, and we have some records of our own of the care and the management plan for that patient. So I think it does benefit the patients, and it's also an educational opportunity for me and other clinicians here to be involved in a neurology clinic.
But is it actually any better than simply picking up the phone and calling a specialist for advice, or the patient having a telephone consultation?
From my point of view, I've often discussed cases with Dr. Hines or his team over the telephone. The difference here is that the patients can actually see the specialist at the other end, and the specialist can obviously see the patient. So it's actually a genuine consultation, albeit remote consultation. So it is a big step up from the telephone, I think.
Well, I've done teleconferencing before. I'm a student at the Aberystwyth University, so yes, I'm maybe more used to it than others might be. So I don't find it particularly strange, really, at all. Because there's a lot you can express in the way people look and gestures and body language. So I think it's much better than merely speaking to people over the phone.